advice for other healthcare facilities on finding funds for their security programs?
So what I do almost on a daily basis, I go through a website called grants.gov. Anybody can sign up for it. It's absolutely free. If you type in the search bar exactly what you're looking for, those grants will pop up. One thing you really need to look for is when the grant closes and the ceiling on the grants. Now, most of the grants that I've qualified for were grants that were non-matching, meaning that you didn't have to put up 50% of the money. The federal government and the state paid 100% on the grant. So
Great.
my secret sauce is to look every day. And if you see something you like, again, take that information, give it to your grant writers, or if you are a grant writer, apply to it. Like I may have shared it with you today in an email that I got a grant sent to me today by the state that had a ceiling of $250 million. So anybody in the state of California can apply to that. Anybody in actually United States can apply to that. That's a Homeland Security, non-matching, nonprofit grant.
So the moral of the story is do your homework.
Do your homework and stay on
And
top of it.
Be diligent. Great.
Yeah.
Anything else you'd like to add? Any other sage advice?
One thing I will add is when you work with a grant writer, whenever they ask you to submit some documents or submit some paperwork, try to be on time because they're on a time crunch as well. So when working with my grant writer, I make sure that if he asks for a document to be signed or a document to be submitted to him, I did it right away, so they never have to wait.
One of my officers was actually fearful of getting the vaccine. His doctor said, "Don't get the vaccine. You're high risk with asthma. Just as precaution, just be careful and be safe." And he ended up contracting some symptoms of COVID-19. He tested positive. And just because of just that little bit of information that he told me relative to his pre-existing condition, I wanted to make sure that I kept an extra eye on him. I am a former EMT, so I do know a little bit of medical to help her. I know enough to be dangerous, I guess, so to speak. So I called him every couple of days, and I told him the second we sent him home, I said, "Look, go on Amazon, order yourself a blood pressure cuff or a blood pressure machine, and a pulse oximeter, so he can keep an eye on his blood oxygen levels." He did it that same day, and the first 72 hours, he seemed to be doing okay. He seemed a little winded, but nothing to worry about. And by day 4, I called him, and very shortness of breath. He was struggling to really just complete a sentence. And I'd asked him, I said, "Hey, when was the last time you checked your vitals, like your blood pressure and your saturation levels, blood saturation levels?" And he goes, "I checked them this morning at like 9 a.m. And at this point, it's already about 14:30. I said, "Do me a favor, check it." And at that point, his blood saturation levels were at 79, which is, for anybody who knows, it's very, very low. With asthmatic type patients, usually they're low 90s, kind of mid 90s, but he was 79. And I said, "Listen, you need to call 911 and you need to go to a hospital. You need to go right now. I'm not messing around. I'm not trying to scare you, but this is serious." He was with my girlfriend's on her way back from work. She should be about 30 minutes. And I said, "Listen, I'm going to call you back in 15 minutes. I said, "What hospital are you going to go to?" He goes, "Well, I'd like to come to our hospital." And I said, "Okay." So if you're going to come, I'm going to notify ER and get the team basically ready for you when you get here. And I called him back in 15 minutes. His girlfriend had just gotten there. And he's like, "Yes, we're on our way." And luckily at that point, our ER department wasn't that busy, where they were actually able to hold a bed for him, and they got him right in, and he was admitted that same day and spent, he had asthmatic COVID-19 or pneumonia, COVID-19 pneumonia, and had to go through a bunch of different treatments and was in our hospital for about 10 days roughly before they sent him home. And then he spent another 3 weeks recovering from that before he returned back to work.
So what were the overall results of your staff members pitching in to help the healthcare professionals at your organization?
Um, Officers, well, they took notice, like I said, of staff and maybe some of the teams that were struggling. If they would see a staff person sitting somewhere by themselves, or maybe leaning against the wall, that was their cue, and they really took that on themselves to stop and talk. Sometimes we'd see a visitor in the emergency department sitting and waiting, and you could just see the concern on their face. And we really stress that to everybody, that during this pandemic, a lot of stress going on, and we need to think outside the box. We need to work outside of that box and try to do what we can to help people, because the pandemic wasn't just affecting healthcare and what we were doing in here. I mean, it was affecting everybody's lives outside of work. We had staff that were working long shifts, extra shifts with very serious patients, that they were actually putting themselves in harm's way. But also when they got off work, they couldn't just go home and get the family and go out for dinner or go to a movie. Things were shutting down. The whole country was closing up. So a lot of stress on a lot of people in a lot of different directions. So everybody was kind of focused on that, as well as patient care. There, if we don't take care of each other physically and emotionally, then we could ourselves start to deteriorate, and start to create or develop our own physical issues. So there was a lot going on and a lot of different moving parts.
So do you recommend other healthcare facilities participate in these and get involved with these fusion centers then?
Definitely. Like I said, I don't know what they're called in other states, but I would definitely recommend other healthcare organizations and seek out and join these programs. Like I said, it's vital to get that information ahead of time and to share that information and know events that are happening, so you can better protect your organization and your staff. And it's been invaluable to us. I also have 3 other alternates in our organization that I was able to recruit to be liaison officer in case I'm not available, or in case it's something that they see in their area of expertise that they can relate to and pass on. So it's been invaluable. It's a very, very good thing to do, and if you can get that information and that intelligence, then that's huge.
Is there anything else about the program that you'd like to add, or that you think our readers need to know about?
Well, here in Pennsylvania, as part of our Fusion Center, we do a lot of education as well. So the Fusion Center will put together like Homeland Security courses and so forth, and get that out to everybody so that we can attend. We also do, like, just recently we had a House of Worship security presentation where we brought together CISA, Homeland Security, FBI, some private sector security specialists, and we had a program. It was about 2 hours, but I mean, we were able to help other houses of worship and religious faith-based organizations, bolster their security plans and help them, be more secure and ready to handle anything that might come. So those are kind of things that also come out of our Fusion Center. And I imagine it would probably be very similar in other states.
So initially, back in August, we were just starting to feel the peak, or the new surge of the Delta variant. So we were knee deep and still managing our surge areas, our surge supplies, space, equipment. We were still having twice a day calls to deal with the COVID pandemic, and then this comes on top of that. So initially, it was really reaching out to the base and making sure that we had all the right contact information. And as you can imagine, taking care of a village, you need a village to take care of a village. So we had to, initially, it was all about setting up lines of communication with our first responder community as well as the base, and then determining, who's on first. Who do we call when this issue comes up? So it was a lot of sharing of names and contact information. What was going to be the chain of command, who was going to make certain decisions. So it was all about setting up those open lines of communication and really looking at kind of like the org chart and the incident command system. Who do we deal with for certain situations? And this particular operation started as Operation Allies Refuge, turned into Operation Allies Welcome. And you have to imagine there was federal resources, state resources, county resources, non-government organizations. So our first call, there was over 62 agencies that were represented on this call.
Wow.
So it was really just determining who's on first, so to speak, and who are we going to reach out to what agency is going to be responsible for what part of the response. So that was really it. It was mostly communication. Then because we were still going through the surge of the Delta variant, we had to make sure that we converted additional space for the surge of the refugees, made sure we had additional supplies, staffing, everybody was having staffing challenges at the time because, employees were being impacted by the variant as well. So we had to maneuver staff from around the organization to support, our new guest from Afghanistan that we were going to take care of.